I think the in aesthetic area, the implant, we want to make the very good, successful outcome. The restoration is very, very important, the temporary restoration. If possible, we not limit healing apartment to healing. This is not a very good way. I will make the temporary restoration. If possible, we will make the implant support temporary restoration. It's the best choice.
I'm sitting here at the DentalWorld conference with Professor Liu Feng from China, who is well known for his international publications in digital implantology. Professor Feng, it's an honor to have you here.
It's my great honor to be here.
Thank you very much. For those who couldn't attend, could you please summarize what your lecture was about?
Today's my lecture is focused on digital implant. I introduced from aesthetic dentistry in China development to digital implant. Digital implant is include three aspects: design, and surgery and restoration. And the major part is the surgery. I introduced the template guide and the dynamic navigation and some other surgeries. In this components, I think template guide is the common technique for a lot of dentists, but the dynamic navigation maybe is a new case, is a fresh technique. In my clinic, I have used this technique 2 years and do a lot of cases. I think a lot of dentists are very interesting about this part.
Yeah, of course they are. You also mentioned that in dentistry, the white and the pink aesthetics are equally important, but when we talk about implants, you think that pink aesthetics are more important, correct?
Yeah. Because I have graduated from the university 23 years. In the first 10 years, I was only do the new natural teeth restoration. In natural teeth, I will pay more major attention in the white part, not too much attention to the pink. But in the past 10 years, I moved our time and more times to restoration the implant, from the surgery to the restoration. I think when we want to make a very, very beautiful, very excellent implant cases, we need to pay more attention in pink, because pink aesthetic is more difficult. And we need to have a very good design, and from the surgery, we need to consider how to maintain the soft tissue, how to reconnection the soft tissue, how to shaping the soft tissue, and to the restoration period, we also to duplication, we also to remain the soft tissue. So I think the pink is the keynote of the implant cases.
To modify the soft tissue, you also mentioned the use of the bonding bridge. Could you tell us what it is exactly?
I think in aesthetic area, the implant, we want to make the very good, successful outcome. The restoration is very, very important, the temporary restoration. If possible, we not limit healing apartment to healing. This is not a very good way. I will make the temporary restoration. If possible, we will make the implant support temporary restoration. It's the best choice. But in some cases, we could not make it. Then we will make the bonding bridge, Madeline bridge or bonding bridge, to use the adjacent teeth to support the bridge. And the bridge has the function to support the soft tissue, to maintain the soft tissue buccal counter and the height. If we don't have the temporary bridge, temporary restoration, the soft tissue will absorb. But if you have it, the soft tissue will attach the bridge, so it will not absorbed. So it is very, very important.
You also recommended the use of high translucency multi-layered zirconia. Why do you prefer this material?
Because use this material, we could make the full zirconia from restoration. It is much stronger. It is for the implant restoration much stronger. I think it's a better choice because the implant was very, very strong, and the patient, a lot of patients use the implant restoration to eat some hard food and use more big force using than the natural teeth. If the implant restoration was not strong, sometimes it will be breaked. So I prefer to use the strong material on the implant. And the high multi-layer, high translucent zirconia could make the full zirconia restoration. It could give us the very beautiful and very strong restoration. And if we want to make it more better, we could use the outside stain. Or sometimes we cut a little bit and use the porcelain veneer, but only the buccal surface. It could make it more beautiful, but not damage the strong. So I prefer to use it.
Professor Feng, thank you very much for sharing your knowledge with us. It was a pleasure and honor to have you.
Okay, thank you.
Thank you.